and I would like to introduce the workshop of this afternoon about a new technology for hand rehabilitation, particularly for patients with upper motor neuron disease. And I would like to share with you some experience, some idea. I hope to have the possibility to discuss with you about your experience, or to discuss how to plan for the future experience, the use of this kind of technology for rehabilitation of the hand, starting from a clinical point of view, from a key point, each one involving rehabilitation, in neurorehabilitation, that would like to check the progress in the last 30 years about the possibility to have recovery of function of the upper limb, and particularly of the hand, after traumatic brain injury, stroke, or other neurodegenerative disease, have to face a key problem. We need something to change because a very important percent of patients are unable to use the upper limb after a stroke or after traumatic brain injury. This means that traditional physiotherapy, traditional exercise program, are programs with a lot of possibility to support the patient, but unable to reach the goal to improve function, behavior, and then quality of life of our patient. Then this is a typical condition that we have to face. The hand of our patient without any movement, immediately after stroke or after traumatic brain injury, before to have spasticity, for example, with the need to maintain movement, able to maintain the range of movement, able to reduce all the problem due to the fact that the patient is totally unable to use it, and to reduce the possibility that no function of the hand means no function of the wrist, and maybe no function of the elbow and shoulder too. And particularly positions like these are positions that reduce elastic properties of the finger flexor, of the flexor of the wrist, and then maybe that when we have some recovery of function in terms of extension, we have to face the problem of elastic properties of the flexors. Then we could explain too, to try to reduce this one, to try to maintain the position, but again, we don't have any function to support the patient continuously and for the time that we need, even if you use dynamic splits in any case. And then we have to face the problem that we have to solve problem of the hand, but the hand means the elbow and shoulder too, and the upper limb means trunk control too. Then we have to face a lot of different multi-joint problem, multi-functional problem to solve, and maybe that using, this is a patient immediately, 10 days after botulinum toxin injection, we are able to change some condition in the muscle, but unable to start very nice exercise protocols.